Well, thank you so much, everyone, for this opportunity. My name is Aditya. With the International Network of People Who Use Drugs, we're based in London, but I'm from Indonesia, and I've been a drug user for 25 years. And let's see, right. So for many years, drug policies around the world have always been fueled with the idea of a drug-free world. Prohibition, moralism, lies, and social control have been in the heart of any drug-related interventions that we know. And war on drugs is a war on people, it's killing our community and affecting people around us. In 2021, it was quite a historical year in the AIDS movement because it was for the first time that the global community agreed on global targets on decriminalizing drug use. The adoption of the 2021-2026 Global AIDS Strategy and also the 2021 Political Declaration on HIV and AIDS included important opportunities to advance our decriminalization agenda and also to strengthen community-led responses and expand and scale up of harm reduction service coverage. However, having these targets at the global level does not necessarily mean immediate change at the community level. And the situation that our community faces on a day-to-day basis is still the same. We are still being criminalized, we are still being punished, we are socially excluded, stigmatized, discriminated against, and we're not seeing these important targets being included into the national strategy, nor that we are hearing these targets being discussed at national dialogue spaces. So I'm going to go over some of the key global AIDS targets briefly and the progress since 2021, because note that this was supposed to be covered by UNAIDS. Unfortunately, they're unable to attend in person, so it was my initiative to add a few slides into this. So these are the 10-10-10 targets. So if you probably heard the 10-10-10, but what is the 10-10-10? So basically the three main targets, and we're really focusing on the first 10, which include less than 10% countries have punitive legal and policy environments that restrict or limits access to services. And from these targets, there are sub-targets under the first 10. And these are the sub-targets. If you look at the Global AIDS Strategy, and it will include the first sub-target is that less than 10% countries criminalize sex work, possession of small amount of drugs, same-sex sexual behavior, and HIV transmission, exposure, and non-disclosure by 2025. And as I said, this is historical because we've never had this target at the global level before. And the other important target is the 80-60-30, or people always mix it with 30-60-80 or 30-80-60, so it doesn't matter. But basically, this is a target that aims to strengthen community-led responses in the AIDS response. But not only to strengthen, but also to ensure that investment goes to community-led. But the question is, who is community-led, right? There are many organizations that claim that they are community-led, but they're not really led by people from the community. They're not led by drug users. They're not led by key populations. So that's something that we need to, that hopefully in this panel later, we will discuss that more. So this is where we are. So in terms of harm reduction targets, I'm pleased I'm not here speaking on behalf of UNAIDS, but this is just what I took from their report. So we have harm reduction targets. We have 50% coverage of opioid agonist therapy, and we are far from that. We are far from that. And this is 2023. Target is 2025. So we have 2 more years. And 90% coverage of needle and syringe program, and only 12 countries of 28 reporting countries achieve 90% targets on coverage. And note that UNAIDS countries over 100, it's I think 160 something. So there are only 28 countries reporting, and from that 28, only 12 actually have achieved. So we are also far from that. And these are the 10-10-10 progress. You see that the blue color here in the chart, the bar chart, is countries that claim to have decriminalized, while the orange is the ones that they still criminalize. But still, please note that even those countries who claim to have decriminalized possession of small amount of drugs, they still impose high fines, exorbitant fines, administrative sanctions, and many others, even diversion to rehabilitation center. They're still coerced. It's still mandatory. So it's in a way that it's not really decriminalization. I will talk more about the decrim a bit later. And for the 30, 60, 80, we don't have tools to measure it at the moment. So we don't know how much money goes to community-led responses, and UNH is still working on this. And this is an ongoing work that we hope that this year can be finalized and can be put in practice starting next year. We'll be able to get the data in the next year report. All right, so this is my presentation. So realizing the gap between the global spaces and national actions, Input published 2 key documents that are aimed to translate high-level documents such as the Global AIDS Strategy and the Political Declaration to simple and community-friendly briefs. And these are the briefs. It's available on our website. And the briefs provide the opportunity to our community to build their awareness and also understanding of the development at the global level. This is important because we know that languages that are used at the global level are often a completely different language that we use at the community level. They also include recommendations that can be used at the community level to hold our governments accountable. So they're quite practical. There are some steps that what communities can do for a particular part of the political declaration, and then you can always use that as your advocacy points. And we also realize that there is a growing misconception on what so-called progress on decriminalizing drug use. Input conducted an assessment report on the impact of the current models of decriminalization on people who use drugs. It provides in-depth analysis based on the realities experienced by our community. The shift away from criminalizing responses and towards more public health oriented approaches is said to be a sign of progress. But one might rightly question the extent to which a shift from criminalizing people to pathologizing them as patients can really be classified as a progress. And too often, decriminalization is discussed as if there is only one model. And this leads to a view that decriminalization anywhere equals progress. But despite the challenges, the opportunities to take urgent and transformative action to rectify this unacceptable situation are there. Last year, Input developed this training module. It's a drug user-led technical assistance module, our rights, everybody's rights module, aiming at building the capacity of drug user-led networks in using the global AIDS targets, particularly the 10-10-10 and the 30-80-60, and linking them with international human rights obligations and treaties in their advocacy. Furthermore, we also developed our first community-friendly legal assessment tools specifically designed and focused on people who use drugs, these tools are hoped to provide the basis of our advocacy in fighting for our rights to health, rights to freedom from torture, rights to bodily autonomy, and rights to liberation. Today, we have a great lineup of speakers at this panel who will discuss and share their experience in their advocacy and, more importantly, in holding our governments accountable for their commitments and promises. And let me close with a statement taken from the Vancouver Declaration. We are people who use drugs from around the world. We are people who have been marginalized and discriminated against. We have been killed, harmed unnecessarily, put in jail, depicted as evil, and stereotyped and dangerous and disposable. And now it's time to raise our voices as citizens, establish our rights, and reclaim the rights to be our own spokespersons, striving for self-representation and self-empowerment. Ultimately, the most profound needs to establish such a network arises from the fact that no group of oppressed people ever attain liberation without the involvement of those directly affected by this oppression. Through collective action, we will fight to change existing local, national, regional, and international drug laws and formulate evidence-based drug policy that respects people's human rights and dignity instead of one fueled on moralism, stereotypes, and lies. Thank you.